Okay, welcome everybody to the VNPC OB AIM Hemorrhage webinar. So I know there was a couple of questions that I received, a couple of emails, and just for clarification, I did send you guys a bunch of emails last week because you guys are my main contacts to the hospitals right now. And there was two different emails. So one, but it wasn't completely clear. So one is currently we have this on the second Wednesday of the month, the OB hemorrhage calls from 12 to 1. We will talk about this a little bit further in this meeting today on whether we want to continue these and what the frequency is going to look like. But those ones are on there for Wednesday. And then there was another email that you all should have gotten that is the third Tuesday of every month at noon. And those are specific to the VNPC webinar series. So what we found last year is we started these probably mid-year last year, and we just have different topics that kind of relate to all of us, but not necessarily specific to one specific topic. So it's overarching. So some of the topics we're going to have so far for this year is just in general, what is Title V? I've been in a lot of meetings lately, and Title V has come up as far as, oh, this is a great funding source. Well, news alert, the state has received and does receive Title V funding, and we have for many, many, many years, but sometimes it's just not known. What do we do with the funding? How is it used? Who gets it? Who benefits from it? So we're going to have, those are kind of the topics that we would cover for these meetings. We're going to have one specifically on hypertension in pregnancy, and kind of where is that as a state. Last year, we did do one on LGBTQ, and he was a phenomenal speaker, and we're looking at bringing him back as kind of a secondary follow-up. Another topic we have coming this year is PRAMS 101. Is anybody familiar with what PRAMS is? It's Pregnancy Risk Assessment Monitoring Survey that is done at the state level, but it has a lot of data specific to health risks, benefits, what our moms are doing prior to pregnancy, during pregnancy, and after pregnancy, up to that 2 to 4 month postpartum period related to exercise, eating, you name it. So we're going to actually have that broken down for us on one specific meeting. So I highly recommend if you guys can attend those VNPC webinar summits. No worries if not, they'll all be recorded. But those ones would definitely be more for staff and for anybody that wants to attend, whereas these are kind of more specific meetings. So I did want to pull attention to that real quick because that was a couple of questions that I did receive prior to this call. But without further ado, I do want to go ahead and share my screen and pull up the PowerPoint presentation. So I know Donald hasn't joined us yet, but I was on a call at 11 o'clock and I told him I was going to go rogue for a little bit of this presentation, and his face was quite priceless because he knows how I go rogue. But anyways, I am going to go rogue for some of this presentation, but don't get scared. What I'm going to actually do is take advantage of showing and highlighting you all what is in the AIM dashboard and how we can actually utilize it and how you guys can utilize it for reports, for data back to your leadership. It's all done for you. So I hope that going rogue will actually be of some benefit to you guys today. And this is something that I haven't done to date. And I kind of want to eliminate some of the learning a new system or a dashboard. So anyways, today we are wrapping up the AIM OB Hemorrhage project. So today is going to officially be our last day. We'll still be moving forward and collecting data. We're still going to be working on it, but we are going to actually wrap up this project. So I know Laura is super excited, and Dr. Chisholm could not join us today. He was being pulled in 100 different ways, but I did want to highlight all of your guys' successes and then point out some areas that we still have a little bit of work to do. Okay, so real quick, the agenda: welcome, review of the dashboard, data from the project, successes, still areas of opportunity, data collection moving forward, what's it going to look like, why do we still need to collect it moving forward, and then our next steps and how are we going to keep this project with the progress that we've made, and then move it to sustainability and continue this work and then improve upon that work as we continue forward. And then at the end, we'll have an opportunity for questions and answers. All right, So real quick review. We did this on the last webinar with the data, but I put this in there more or less so you guys can have the links. But there's two links that you guys need for the data. So there's the one to actually get the AIM data is the Safe Healthcare for Every Woman. That will give you what data we're actually collecting as far as our process and our structure measures and kind of what does the bundle look like. The one under it, the maternalsafety.org, is for how to actually sign on. So if you are the director or the leader for this project at your hospital, you should have access. If you don't have access, I need you to send me an email at my email. I need your first name, last name, and the hospital that you need access to. Now, I don't think there's anybody that's requested multiple hospitals, but if you're in like a system like Centera and you are the QI person that's overseeing 2 or 3 or 4 projects at the different Centera hospitals, by all means, you need access to those hospitals if you're going to help move this work forward. So just let me know that in the email. It is a quick me entering you into the access, and you should have access in an email from AIM within 5 to 10 minutes. So if you have not done that already, or if someone was previously in there and you're new or not able to see it, please email me and I'll get you guys plugged in today. And if anybody just joined us, if you can just mute your lines just so we can not hear any background noises. Okay, so are you currently using the AIM dashboard? And I don't know because I can't see if you're pulling off reports or not. I just can give you access. So for writing, yeah, Susan, if you can just send me an email, that'd be fantastic. And what hospital you need it for, or if you need it for multiples, that would be great. And I'll get it to you today. Okay, so you can create individual reports by hospitals. I'm going to show you all how to do this. You compare your hospital to other hospitals in Virginia. Then you can compare your hospital to other states implementing that same bundle. And this is honestly, this system is very user-friendly and an excellent way to highlight your successes for leadership. And I'm going to show you also how you can, actually, you just click a button, it downloads a report, and then you could just, it's even packaged as a report that you could highlight this and show this to your leadership. So some of these changes have recently happened because AIM has just brought on additional leadership to actually work to make the system a little bit better. So I'm learning as we go as well. So for this project, I wanted to highlight where we were, where we've gone, and where we are currently. So, you know, you can refer to the process and structure measures, but I've written it on all the screens and you'll be able to follow along. So there's 2 types of data that we're collecting with the AIM Hemorrhage bundle, and that's the structure measures, which once you have it, it's in place, it's done. And there's 6 of those. And then there's the process measures, which we need to continue to collect to ensure that we're still continuing to do that work. And that's more specifically related to our provider education, provider protocols, our OB our OB nurse education, our nurse protocol and education, our risk assessment. Are we running drills on the unit? If so, what are we running the drills on? And then our QBL or our blood loss, and are we conducting this on what percentage of patients are actually having this? And I'm not sure I said this, but the hemorrhage risk is also part of the process measures. So these are the ones that are easy to get complacent with if we're not continuing to collect data and we're not continuing to keep this in the front of our mind. So we currently have 63 hospitals that are in the AIM data portal. Now, are all of those hospitals, birth hospitals, inactive? No, they're not. There are a certain amount, well, last I knew, we have about 3 hospitals that have actually closed their maternity unit due to COVID, and we don't know when they're going to be opening. And I heard a rumor the other day that there's another couple hospitals that are looking at transitioning some of their maternity units to COVID hospitals or COVID units. So that is going to change these numbers. These are fluid numbers. The reason we have 63 up here is that based on the birth certificate data reports that I pulled down from the state states there was at least 10 or more births that occurred at that hospital. Now those, and I know 2 of those specifically were births that did not have a birth hospital. They had an ER. One hospital actually had 23 babies delivered in their ER, and then they moved them to a unit. So that hospital's in here, even though they probably would not be implementing the AIM bundle. So use that 63 as kind of a tentative number, but at least kind of that's our baseline of what do we know we have that has at least capacity with our birth hospitals. So for this project, we have 11 hospitals that have just never submitted any data. That's fine. We'll catch up to them. So as I mentioned, we have the 3 hospitals right now that have closed maternity units due to COVID. In July, we had 36 hospitals submit data. Now, 33 of those hospitals submitted both process and structure measures. 3 of them only submitted structure measures. So it shows me as a partial or an incomplete data collection. And then for December, we had 22 hospitals submit data. 20 of them submitted both structure and process measures, and 2 only submitted structure measures. So we still have some area of opportunity there and areas that we can work on for actually submitting data. All right, so the next screen, and I apologize, I'm having to move y'all's faces back and forth so I can see the screen. Okay, so overall for structure measures, this is what we're looking at. For structure measure 1, we had 33 hospitals out of our 63 that have completed it, that have done, and we won't rewind this. So once you've completed it, it's done, it won't go away. And then structure 2, and we'll show you here in a second what each of these measures are. Structure 2, we've had 50. I believe this one was the hemorrhage cart. Structure 3, if someone can mute their line, please. Even trying to call out. Can someone mute their line? Thank you. Okay, so it looks like we're averaging, and I don't want to spend a lot of time on this slide, but it looks like we're right around the 50 percentile. So we've got at least half of our hospitals are submitting data for our structure measures that have actually completed each of those measures. So, hey, y'all, that's good, considering we've only been really kind of hard working on this for about 8 months. So this is something to really be proud of. And some of these ones are harder. These are structure 3, if I am remembering correctly, is the debrief. And I know that the debrief one has been kind of a challenge for a lot of hospitals. And sorry, y'all. And then number 6, this one is the QBL, or oh, no, sorry, this is the EMR one. So again, I know that has been a difficult one to obtain because you've got to work with your EMR records. You've got to get these actually put into the system. And that is more than just kind of sitting down, writing a policy and then educating everybody. So these ones are a little bit, these are the harder ones. So I would kind of expect these to be a little bit lower. So for the process measures, again, we just want to look at the overarching, and the reason, I don't know why this one's not showing. Oh, I know why, because I had y'all blanking it. So I entered this data in Q1 of 2021, but it should be actually showing for Q4 of 2020. So this just represents that we had 33 hospitals that submitted process measures in the summer, and then we had 20 hospitals, which I just highlighted a second ago. All right, y'all, so here's where we're going to jump to the AIM dashboard, and we're going to go a little rogue. So we can do this. If I can get my, no pressure. All right, so we're going to share, and we're going to go here. All right, can everybody see this? You should see a purple line at the top. It says AIM Dashboard Center. So I did not enter you guys from the beginning, but I am going to show you how to get to this screen from it. So it says right now, obviously, I'm the one signed in. What you guys are going to do from the home page is you're going to click on Virginia Dashboard, and then you're going to be able to pull up either structure or process measures. And so this is what I wanted to kind of highlight with everybody as we go through this to see where we're at. Again, and I'm going to scroll really quickly because I don't want anybody really to fixate on any of the data, but this is what you'll see at the top. So this is the whole project, all the hospitals that submitted data by structure measure number 1, which was the hospital developed an OB-specific response, resources or protocols to support families. But if I scroll down, I can see each of the hospitals that have actually completed it and when they've completed it and if it's in place. You will not be able to see all the hospitals. You'll be able to see your hospital and click on your hospital to see when you completed it. So I just wanted, so it's a simple click. So for this one, when we first really reported, we went from 50.8, 32 of 63, and at the end of this project, we're at 33. So we did actually go up a little bit, which again, we want to go, we want to track up. So we're at 52% that have actually completed this project. Structure 2, it'll take you a second, and it'll loop, and we were at 1 of 63 in January 22, and we are now at 50 of the 63 are conducting debrief. Great job. So we're almost at 80% for this one. It might be this minimum being the Joint Commission criteria. All right, for number 3, and again, this is for all hospitals in Virginia. I can highlight your specific ones, and I can work with you guys on showing that. But we started at 26 of 63 in June, and we're up to 29. So we're up to 46% for the hospitals. And this one is the review of all cases for severe maternal. So the hospitals establish a process. Hemorrhage cart is 4. And started at 17 in February, and we are up to 37. So again, great. And honestly, I think we've had a lot more that have actually done this. I just don't have the data that's been submitted to actually put in. So I do want to stop and highlight this, that if hospitals are doing this work and if they're not submitting it, I have no way to demonstrate that they're doing it. So even if you've completed every one of these projects back in, 2015, please submit your data so we can put this in the dashboard that your hospital is done, and we can highlight and add this to the number. As we're going through this, I do want to mention, this is actually in the AIM dashboard. So this is at a national platform level. So all AIM states can see Virginia's data as a whole. They can't see it by hospital, but they can see it as whole. So when they pull this up, they can look at in June 2020 on structure 5, Virginia as a whole has 37 of 63 hospitals that have completed this one. So I definitely want to have your data if it's complete. And if it's not complete, I want to be able to highlight how we can help you out. And then structure 6 is in the EHR, and we do know this one was a little bit more tricky than the other one. So 33 of 63 were right at 50% of hospitals that are actually submitting or said that they have done this one. All right, so we are gonna go back to the dashboard, and this is something that you guys will all be able to see as well. You'll be able to see for your hospital where you've been by measure by quarter. Again, this is showing you the entire dashboard right now of all Virginia hospitals, and this is kind of as we've gone up, and we've gone up in every single one of them, or we've stayed the same. So that's likewise great news as a whole. So we're going to jump back over to the process measures, and now I can go down again. You guys can see this whole chart, and then we can actually go in and see where we were by, and this one's kind of cool. It takes it by provider. We can either go by volume, NICU level, so we can change all these different levels, and then you can look at the quarter that you're wanting to specifically highlight. And so right now, because this was data entry from 2020, quarter 4, we can see now if I scroll over these, you will be able to see what hospital it is of the 20 that submitted for quarter 4. Where you'll be able to see is you'll be able to highlight which hospital is yours. It will show your hospital, and then it'll show you where you are compared to the other hospitals that submitted, but they will be de-identified. But you'll be able to see by birth where they're at. So, and again, if you scroll down, everybody's hospital is right there that has submitted. So as we continue to put more data in here, again, this is the importance of sustainability. As we continue to put more data in here, we'll be able to see how we continue to improve and add more hospitals to this process. So the trend line is also extremely beneficial. Again, we've only had 2 data entries for provider education. So hence the kind of straight line, but we started at 65 and we're at 63.5. I don't think it really changed. It was just, we didn't have as many hospitals that submitted data for these measures. And then we can go through each of these measures. This one, I'm very impressed with everybody. We're definitely on the upward trend of this one. So we started here in about the 50th percentile, and we are now at 94.5% of all hospitals are actually doing or reporting hemorrhage risk assessments. So we can do all these. I've summarized this, but there's a lot that you can actually play around with. The reason this went down, this was the first baseline. I believe we had 17 hospitals that had submitted at this point, and then we had a couple, and then we continued to go up. So again, you guys are doing great work when it comes to the dashboard. And oh, this is the other highlight that I wanted to show. So this is data that is entered in from the Virginia Department of Health, and this is based on our hospital discharge data. So they are actually pulling these numbers. So we can see by count. So they have 56 hospitals, which kind of makes sense based on our 63 birth hospitals. 56 is probably more appropriate of who we actually have as delivering centers, and where we are with our SMM and our MB, our severe maternal mortality, and our severe maternal morbidity among hemorrhage cases, among cases excluding transfusion, and then among all. So we are trending down, which, and this one looks like it's pretty stable. And this one we're actually trending up, and this one we're trending down. So this will also be able to give you kind of that general information specific to hemorrhage based on our dashboard. One more thing before I get off of the dashboard is I do want to pull up this report, and I pulled this up. So this is how, if you download it specifically, and I'm going to go close. Yes, I'm doing this for VCU, but it will do yours, and it is a 9-page report. And if you go through, it'll show, so here's your structure measures, when you completed it by, and then your completion rate compared to the rest of the state, and then your rate for provider education, what you've reported so far in a trend line, and it'll go through and do this for each measure, for process measures. So this is a perfect way to actually print this off, whether it be annually or however you all want to do it, but this is done for you. I enter the data that you guys give me, and then all you have to do is click and download this, and then you can provide this to whoever wants it. So again, a way to highlight the work that you all are doing, and it should take 5 minutes, no more than that, to click and print is really all you have to do. So I did want to highlight that. All right, let me go back to the dashboard, or I'm sorry, not the dashboard, the PowerPoint. And I don't want to do that. Okay, can everybody see that? All right. Okay, so I wanted to highlight the successes. I know I showed you graphs, but sometimes seeing it in a different sense is better. So I think the most important thing that we need to highlight is the fact that the VNPC, this is our first project, and we now have data in a dashboard. A year ago, we could not say this. So it might seem very small and very superficial, but this is huge. This is awesome that we actually have data in the dashboard. We also have 35 different hospitals that have completed both a process and a structure measure at one point. So I will say, of the 33 that submitted it at mid baseline, or at midpoint of the project, and then the 20 that submitted for this last quarter. We had 2 additional hospitals that submitted this last quarter that had not previously submitted data. So we can say we have 35, which is great if we're looking at the number of 56 or even 63. 94% of those that have submitted data, so of 35, 94% are conducting a hemorrhage risk assessment based on their structure measure that they reported. 91% are completing hemorrhage nurse education. 91% are completing hemorrhage nurse protocol education. And then on average, each hospital is running about 5 unit drills for their hospitals. Now, I will say a caveat to this is we've got some hospitals that are running 1 and 2 and 3. We have other hospitals that are reporting in the 20s. Now, I think these are our bigger systems that are running multiple drills, multiple shifts, and multiple topics. So I don't want to get astray that some of our smaller hospitals are right there with that 1 to 2 or 1 to 3 number of unit drills, which is very appropriate. So those 20s are kind of skewing the data a little bit when we come to this. So areas of opportunity, provider education. It's just continuing to be an area of opportunity, and we've highlighted some of the reasons why in a past webinar. Some of it that they're community hospitals and providers have privileges, but there's no way to actually ensure that they are completing the requirements annually to have this education. Or there's so many that have privileges, but maybe they're only there once or twice a year. And so it's hard they're on the books, but it's hard to capture them and actually get them to do the education. If that is your hospital, let's talk. Let's brainstorm some different ways to determine how we can get this education to them, because we do know that with education, our maternal mortality goes down because they're familiar, they're aware, they know who to contact, they know what the process is to actually go through if this happens to be one of their patients. So those are definitely 2 areas of opportunity. And it shows that you guys are doing it because you're able to get the nurses, but you guys have more, and I say you guys, the system has more control over ensuring that nurses do their annual requirements. Whereas if it's a community hospital, it's a little bit trickier to ensure that this is happening at the provider level. The other one, and this is across the gamut, is blood loss, tracking it. I know different hospitals are looking at different systems or AI to see if they can bring it on. I know a couple of hospitals in Northern Virginia are doing like an iPad and a project with a company that you can actually hold it up in front of the iPad and it somehow measures exactly how much is lost. I know another one is working with scales that's embedded. I know another one that is actually sending text messages to providers that they can, again, take a picture of it and it can tell. So I understand though that not all hospitals or systems have or want to spend the money on these resources or tools. So how else can we ensure that we are maintaining or tracking quality QBL? So let's brainstorm, let's talk. Maybe this is another potential webinar that we have moving forward. And we have some of our hospitals that are using some of these AI tools to talk about that and see how they're doing it and if they are successful, or if there's other ways to do it. So we are all here collectively to learn from each other. And I know that some hospitals are way above the curve and other hospitals are like, how do you spell hemorrhage? And somehow we have to figure out how we can actually work together because we are one team, one system. And at the end of the day, it is our moms that we care about and our babies. So if we can share or mentor, I can't speak highly enough for that. So next step, sustainability. This is really where I need some input from you all. And you can give it to me today, and that would be fantastic. If not, I'm gonna put together a survey because I completely understand wanting to be anonymous as well. I'm gonna put together a survey on kind of some things that went really well, some things that didn't go well. And believe me, I've already critiqued this, and I know there's a lot of ways that we need to improve as a whole with the VNPC and how for the next project things didn't run so smoothly this time, or we didn't do this, or we didn't do that, noted. But I would love to hear from you all as well of what you think went well, what you think definitely needs some improvement, and you're not going to hurt my feelings, and things that you still need from us. Because just because we're wrapping this project up does not mean OB hemorrhage goes away. In fact, it's kind of more important. We got to figure out how we're going to keep this on everybody's forefront as we unload another project. So is continuing webinars really something we want to do, talk about? Do we want to do it monthly? I don't really think monthly is kind of the way we need to go at this point. Bi-monthly, is that still too frequent? Quarterly, I'm open to that. I'm really open to anything, but I don't know this unless, because this is really for you guys. So what are your thoughts on continuing webinars? Maybe bringing in some hospitals that are doing great and having them highlight what's working so well, where their challenges were, how they overcame that. But likewise, if that's the case, I need hospitals to be able to volunteer that information and provide this back to other hospitals. One-on-one calls. I am kind of interested in this because I asked a question on the end of the survey of, do you want some help? And if so, let's talk. And it was kind of comical because our hospitals that had like submitted, they did all the structure measures and then they submitted 90 to 100% for everything. And then they requested help. And I'm like, but you guys are doing a great job according to your statistics. But then I'd have hospitals that had like only 2 structure measures completed, missing 4, and like entered 2 or 3 process measures, and they were in like the 50s or 40s or 30s. And they're like, no, we don't need any help. We're good. And I'm like, kind of confused here. But so I don't know if you guys want or need help. I don't want to waste anybody's time because I know time is of an essence for everybody. But if one-on-one help calls could help, whether it be me helping brainstorm, whether it me giving you resources on what does a good protocol look like, what does a good education look like, how can we get these community providers engaged, what are some other hospitals doing, or is it that you're having challenge with QBL? Can you set me up with another hospital that's doing a phenomenal job with QBL, and maybe we could, you know, kind of do train them, mentor and then trainer, and how can that benefit? I'm here to help you all. I just need to know that you need or want help. And then how do you want me to help? And I will do the legwork to get that help for you. Survey, we already talked about that. I'll be sending that out. Please, please, please be as honest as possible. You're not going to hurt my feelings, and I'm not even going to know who you are. So the only way we're going to get better with projects as we move forward is if we critique and identify things that didn't work so well on this one and areas on how we can improve moving forward. And then reporting. Reporting is going to be, right now, I think doing it 6 months is kind of the best way to do it, to make sure that we're not losing our footing on this. And then we can reassess and see. Now, what I want to do is, if you've already completed all of your structure measures, you don't have to submit those anymore. They're done. They're done. What I do need is process measures. So I will send each time that Word document just to remind you of what the process measures are, and then you can just go in and submit it. There's 6 questions. They're not going to change, and we can go from there. I am going to put a little bug in everybody's ear, is that I'm currently working on an incentive program for all the hospitals. Guess what's going to be there? Reporting for OB hemorrhage. So it's going to have points tied to it. More to follow. We're going to roll this out in July 1st. So there is some incentive to continuing with this reporting and continue with submitting these reports, but I don't want them to be a huge lift. I want them to be usable for you guys and sustainable and time appropriate. So maybe 15 minutes tops to report that. Once you've completed the structure measures, you're good with it. If you've only got 2 of the 4 structure or 6 structure measures done, if you've completed the other 4 with the next reporting, then the reporting after that, you won't have to report anymore on those. So I think that's it. One thing I did forget, and I do want to mention this real quick with reporting. I know you guys kind of saw that email, the last one, and I wanted to kind of touch base on that, why I put that in there. So if you're not familiar with this, I do an annual report to the General Assembly due December 1st every single year. I have to. That's the requirement for us to have funding from the General Assembly. What does this report entail? If you Google it right now, it's posted on the website. So you can see from the General Assembly what I actually put in there for last year. But you will see in there every hospital by name that submitted data. So if you didn't submit any data, your name is not in there. What does that mean? Well, it means that they're looking, GA can see what hospitals are participating in the VNPC projects and which ones are not. Now, I didn't call out the ones that are not participating. They have to do a little bit of math and a little bit of figuring it out of who didn't participate, but everybody that participated, your name's in there. So kudos to you, you're getting recognized. And in all honesty, I think all of us want our names in there. Or if you don't, I'm sure leadership does. The other thing, and this just happened as of last week, so if you're not familiar or not in the know of this, AIM, the national chapter, went for HRSA funding 3 years ago. They were able to then give some of that HRSA funding down to the state. Virginia is currently a recipient of that HRSA funding by way of AIM annually. It's $9,000, nothing to get super excited about, but it is funding and it is helping us to continue to move these projects forward. But what do we know about anytime you get funding from a funder is they want to know the data. So they're able to see on the AIM dashboard everybody that submitted data. They also know who hasn't submitted data because all the hospitals are in there. So what they also requested as of last week is they wanted me to actually break it down of every hospital that submitted data for the AIM dashboard, the number of births that occurred in 2019 at that hospital. So I pulled down, in working with VDH, all the births that occurred at that hospital because they want a percentage of how many hospitals are submitting data for AIM based on the number of deliveries. And so we were right around, and don't quote me on this because I did it on a different sheet, but I think we're right at 78% of our hospitals that submitted AIM data has 78% of the births that occur in Virginia. So I'm going to highlight those data statistics specifically next week on the VNPC webinar, but I do want to let you guys know that names of hospitals that are submitting data is being published in those two means right now. One through the AIM dashboard by way of and going to HRSA, which is the national federal agency, and then the other one is at the state level annually. So I want to be completely transparent with that. So without further ado, we have about 16 minutes left. Is that right? Yeah, 19. I can't even tell, 19 minutes left. So if you guys have any questions specifically, feel free to go ahead and ask or chat them in.
This is Jackie from CarePlex. I missed the beginning part of your presentation. I apologize. But
no worries.
Did you say we have access to see the data you just put in?
Mm-hmm. Yes, you should for your hospital. So Jackie, if you don't have it, send me an email and send me an email what hospital you need or want access to, and I will make that happen. I have a meeting from 1 to 2:30 today, but at 2:30, I will make sure that I put it in. And then AIM will send you an email. You'll click on that link and you'll create your own profile, but you'll be in there and you'll have access. Now, all the other hospitals besides yours will be de-identified, but you'll be able to see it based on number of births, based on region, that kind of stuff. Does that help?
Yes, that'll help.
Okay.
Thank you.
Yeah, no problem. Anybody else questions? Anybody else excited this project's over with? knew Laura would be. No, you guys have done great work. And we had to start somewhere. And what I love is that I have my usuals that are on this call. So
yeah,
I do appreciate that.
Shannon, I just wanted to say that I am proud to have been a part of the first VNPC AIM project. And I'm excited, so excited about the progress we've made. I know we talked about how some of it got a little push because of Joint Commission, but hey, we'll take it. And that's only helping our moms and babies. So I just wanted to thank you for all that you've done, for your consistent communication, and your commitment to this project and helping to move it forward to where we are now and in the future. So thank you, Shannon.
Well, thank you. Nobody's asked what our next project is. Does anybody want to know?
So what's our next project?
Thank you, Jackie.
So I am super excited about this next project, and I think we're really going to have a lot of impact with our moms and babies, even with this one. So we are going to actually call it the 4th trimester, but AIM is in the process of rolling 3 projects into one with metrics, which they don't currently have. If you look on the website right now, you'll see that there's a postpartum care one, there's a transition to well women, and there's a maternal mental health one. But if you look closer, or maybe it's only on my side, there's no metrics that are assigned. It's just, these are great things. This is what you should do. This is how you get your moms ready. This is how providers should handle it. But they are redoing the bundle as we speak. I just had the meeting at 11 o'clock today, and they're redrafting everything, and they're combining the 3. So probably my 3 favorite bundles, and we are going to roll it out in, they're saying March, April. I'm anticipating May, because I want to be able to give everybody a little bit of time to breathe and kind of let go with OB hemorrhage, and then kind of tee up so we're all familiar with the bundle and what the expectations are for us to launch in May. And yes, Travis, I am beyond excited with this. Like, I'm so excited. They've really done a great job with it. And in there, they're embedding respectful care. They're looking at inequities, and like, they're doing, I'm so excited. Like, I'm really, really excited. And maybe it's the maternal mental health aspect of it, but there's a lot of opportunity for here. And especially, and I'll tell you all a little secret, I am working on my dissertation right now, and my dissertation is actually looking specifically at barriers to screening for maternal mental health. When ACOG has put the recommendations out, AAP has put recommendations out, and why are we still not at 100%? And why are we still not referring, and kind of what's it going to take? So this, with a quality improvement project, we'll be able to dive a little bit deeper and really understand why this is not happening. The other exciting thing, for the first time with our quality improvement project at the VNPC, we're going to actually be able to take it out and work with our community providers. So it's not just going to be hospital based. It is, but there's going to be, you know, after their discharge and delivery, now what? You all aren't seeing them back for 6 weeks postpartum. You're not seeing them back for their well women's exams. It's not happening unless it's in the ER. So how are we doing that care coordination from delivery to the office visit, from, you know, OB, GYN, and then transitioning it? Are they back to a family practitioner? How are we transitioning to our well child visits with postpartum screening through baby's 6 months well child check, which is the guidance by AAP? So it's exciting. We're gonna have some new challenges, but I think that we are ready for it, and ultimately it's just going to hopefully positively impact both our moms and babies. So if you can't tell, I'm really excited about this topic. So any other questions? I don't want to cut anybody off, but I definitely want to, you know, do my due diligence to give you guys some time back if you don't have any further questions. So as always, please, oh, yeah, So Shauna said her microphone's not working, but thank you thank you for all you've done. Sorry, not been able to be. You guys, yep. So they're a perfect example. They've combined 2 birthing units down and all this COVID stuff. So they've had a lot going on. So I know that's the case. Thanks, Shauna, for all of your support. Thank you for jumping on. I honestly thank everybody on this call. I can't do this if you guys aren't on boots on the ground, really helping to pull this work forward. So we are one team. I'm here if you guys need anything. You guys can reach out for simple questions because sometimes it's not as simple as you think, and I'm happy to find an answer. But congratulations for everybody being done. Great job. I will get everybody added to the AIM data portal that is not currently there that wants to be. And I will send out the links. You guys can watch this webinar later if you want, or pass it along to anybody. So without further ado, happy Wednesday. Have a great day. Happy New Year, everybody.
Thanks, Shannon.
Bye.